Next on this slide, we have the fishbone diagram. This is a tool that's essentially used to help identify the different causes and group them into different categories that lead up to the bigger picture of what the problem is. So therefore, you have the problem, and you have different categories and factors that contribute to this problem. And then within those, you go ahead and you brainstorm different possible causes that are within those categories, which all work together and led to the initial problem. So for my case summary, we have that the problem was a near miss of fentanyl administered incorrectly. And my 4 categories are environment, technology, safety, and people. Under environment, we have night shift, which can lead to exhaustion, especially when most people are sleeping during this time. They have changed and converted into working at night, especially for a new grad nurse who's on her 3rd shift of this new type of work. Nurses that are available for independent check. This could be the same as day shift, but during night shift, maybe the nurses are a little more sleepy, irritable on their 4th shift, and it might just be easier for someone not to want to ask, and that's a possibility. The rooms are darker, and oftentimes nurses don't want to wake the patient or cause any irritability, so sometimes they'll try to do their work in the dark, and this can cause patient mishap errors by not being able to read the name band, not being able to look at the medication dosages correctly, and so on. So for technology, we can have that the pump might have had a possible defect, or that the dosage was input incorrectly, which can happen if someone's not properly trained on the usage of the pumps. Safety, the patient is the overall, having them safe and in optimal health is our goal. So with the new nurses, it's hard when they're trying to impress their preceptor, maybe trying to dig deep for all the skills they've learned and try their best, and they sometimes can maybe be fearful of asking for help to not look incompetent, or maybe there's bullying on the unit, or just a lack of teamwork and communication. And for people, the new grad nurse with limited experience, fatigue on her 3rd day shift, and lack of independent double check, which is needed especially with a medication such as fentanyl.